Now, inventors and advocates gathered recently here in Washington, D.C. to exchange and present groundbreaking solutions and technologies that save lives during childbirth in the developing world. The Saving Lives at Birth Development Exchange featured discussions, workshops, meetings, and a marketplace with 92 innovators. The event focused on meeting the needs and realities of women and children in low-resource settings. Launched in 2011, the Saving Lives at Birth Partnership includes the U.S. Agency for International Development, the Government of Norway, the Bill and Melinda Gates Foundation, and other partners. Maternal health advocate Princess Sarah Zaid of Jordan attended the event.
I think that the creativity and hard work of the innovators from around the world, and to see how it is that both inventors from the developing world and from the developed world are using their brilliance and genius to save the lives of mothers and newborns. And there are some incredible devices that are both high-tech and low-tech, and that can be scaled up and used out in the countries that need them to save these lives.
Joining us via phone from Baltimore, Maryland to discuss one of these innovations is Dr. Harshad Sanghvi, Medical Director and Vice President for Innovations JHPIEGO, an international non-profit health organization affiliated with the Johns Hopkins University. Dr. Sanghvi, welcome to the program.
Thank you for having me, Leonard.
It's good to have you. First of all, the JHPIEGO's innovation, which is called the Hemoglobe, is a device that aims to address anemia. Before we even talk about the device, tell us about why it's so important to address anemia with regards to even the diagnosis, which is very fundamental.
Yes. So anemia is a massive problem in Africa and worldwide. Almost 100,000 women die of anemia every year during childbirth, and 600,000 newborns. And then anemia also causes significant loss in intellectual capacity, in physical ability to do work, as well as economic potential. So it's a huge problem. And the challenge is that we are trying to address anemia from a clinical perspective as well as a public health perspective. And we need better and newer ways of addressing this really old problem over which we haven't really found the best of solutions.
So now the challenge here that you're addressing obviously is with regards to diagnosis. Tell us about this device, the specificity of this innovation. Why did you come up with that? How did you come up with it?
So the idea is to try and detect anemia without drawing blood, using a simple sensor and cell phones. And cell phones are now becoming universal, even in many countries in Africa. So we are exploiting the power of the cell phone to translate signals from a very low-cost sensor to display hemoglobin levels. So our idea is to have community workers go house to house to detect anemia without drawing blood. And then these anemia levels are plotted automatically on a map so that we can target public health actions.
So what type of training do these health workers receive? If they don't need to obviously learn how to draw blood, what do they need to know?
So this is an extremely simple technology. All the community health worker has to do is to apply the sensor on the finger, and the hemoglobin level is read out on a cell phone. And you don't even need to look at the numbers because we have color coding. So if it is severe anemia, then there will be a red signal, and then the community health worker can then advise the client to go and seek care at a nearby health center. More importantly, I think the data from the cell phone is automatically transmitted and it populates a map so that public health officials can actually determine which areas in their country or their region has the highest levels of anemia, and we can target public health actions so much better.
So this obviously helps with regards to building a statistic and getting numbers, but what is the next step once anemia is detected?
So I think there are a number of things, and clearly the basic things such as improving nutrition and providing micronutrients such as iron and folic acid, treating worms is critical and important. But sometimes we also, especially in pregnant women, if there is severe anemia, especially at the end stage of pregnancy, we need to bring them in for transfusions or iron therapies that only can be provided at hospitals. So this allows us to target our resources so much better and address a particularly challenging problem.
Now, finally, how available is this device for now?
So at the moment, the device is in development, and we intend using the Saving Lives at Birth grant to move the device to a testable stage, and we plan to do these tests in Kenya in early part of next year.
Okay, Dr. Sanghvi, thank you so much for joining us.
Thank you. Thank you for having me.
And our thanks to Dr. Harshad Sanghvi, Medical Director and Vice President for Innovations at JHPIEGO, for joining us today on Africa 54. And that's our Africa Health Network report for today. For more health news and developments, be sure to visit our website, africahealthnetwork.com.